Welcome to today's video about side effects of antidepressants. Millions of people take antidepressants worldwide, yet most have never been told about the darker side of these medications. Hidden within scientific journals are 14 documented side effects so severe that major medical agencies are now scrambling to update warning labels globally. Some of these effects persist for years after stopping the medication. Others may be permanent. In the United States alone, 13.2% of adults take antidepressants according to National Health Interview Survey data. Right now, someone is taking their first antidepressant pill without knowing these risks. Today, we're exposing what decades of peer-reviewed research reveals about antidepressants, findings that could fundamentally change how you view these medications. This isn't medical advice, but it is your right to know. Always consult your healthcare provider before making medication decisions. But first, let the science speak for itself. If you're new to our channel and committed to making truly informed health decisions, welcome to a community that believes in evidence-based truth. Hit that subscribe button and ring the notification bell so you never miss our research-backed content. Drop a comment letting us know where you're watching from. We love connecting with health-conscious viewers worldwide who demand transparency in healthcare. Alright, let's dive straight into the side effects of antidepressants, starting with number 1. Sexual dysfunction and post-SSRI. Sexual dysfunction. Let's start with perhaps the most life-altering side effect that many patients never see coming. Research published in prestigious medical journals reveals that between 10 to 34% of patients taking SSRI experience sexual dysfunction. But here's what's truly frightening. For some people, these problems don't go away when they stop the medication. This permanent condition is called Post-SSRI Sexual Dysfunction, or PSSD. A groundbreaking study from Israel analyzing over 12,000 patients found that about 0.46% of people who take serotonergic antidepressants develop irreversible sexual dysfunction that persists after discontinuation. Think about that. Nearly 1 in 200 people may never recover their sexual function. The symptoms are devastating: complete genital numbness, inability to achieve orgasm, erectile dysfunction, and total loss of libido. PSSD has been officially recognized by the European Medicines Agency in 2019 as a medical condition that can persist indefinitely after stopping SSRI. Australia's Therapeutic Goods Administration issued updated safety warnings in 2024 requiring all SSRI labels to mention this risk. One study found that 55% of patients who switched from SSRIs to non-serotonergic antidepressants still had sexual dysfunction 6 months later, suggesting irreversible damage. Next, number 2. Emotional blunting and numbness. Imagine feeling like you're living life behind a thick glass wall, unable to fully experience joy, sadness, or love. This isn't depression, this is emotional blunting, and research shows it affects an astounding 46% of people taking SSRI, SNRI, or tricyclic antidepressants. A major study published in the Journal of Affective Disorders found that patients describe feeling emotionally numbed or blunted, unable to cry when they should or feel excitement about things that once brought them pleasure. Brain imaging studies reveal why this happens. SSRI reduce activity in brain regions responsible for processing both positive and negative emotions. University of Cambridge researchers discovered that escitalopram specifically impairs the brain's reward system. This explains why patients report feeling emotionally dull and finding less pleasure in activities they once enjoyed. The truly chilling part? Many patients report this emotional flatness feels worse than their original depression. The Cambridge study showed that between 40 to 60% of patients taking SSRI experience this side effect, and this emotional numbing can persist even after stopping the medication in some cases. Next, number 3. Serotonin syndrome. Here's where things get genuinely life-threatening. Serotonin syndrome occurs when your body accumulates too much serotonin, and it can kill you within hours. While often triggered by combining multiple serotonergic medications, it can happen with just one antidepressant, especially in people with certain genetic variations. The initial symptoms might seem harmless, a slight fever, some restlessness, mild confusion. But serotonin syndrome can rapidly escalate into a medical emergency. Research published in Molecular Sciences documents cases where patients developed high fevers reaching 106 degrees Fahrenheit, uncontrollable muscle contractions, seizures, and complete cardiovascular collapse. What makes this particularly terrifying is how quickly it progresses. Studies show that 30% of cases develop within 1 hour of exposure to triggering medications and 60% within 6 hours. The Hunter serotonin toxicity criteria show that even subtle combinations of medications can trigger this deadly condition. Research reveals that as SSRI use increases worldwide, cases of serotonin syndrome are rising in parallel, making this a growing public health concern. Next, number 4. Bleeding and blood clotting issues. Your blood's ability to clot properly might be silently compromised without you ever knowing it. Large-scale studies involving hundreds of thousands of patients have revealed that SSRIs significantly increase your risk of gastrointestinal bleeding. The mechanism behind this should truly concern you. SSRIs deplete serotonin from your platelets, the blood cells responsible for forming clots when you're injured. Research published in Nature Scientific Reports shows that when SSRIs block serotonin reuptake, platelets become essentially handicapped in there to aggregate and stop bleeding. This means that even minor injuries could result in dangerous blood loss. The risk becomes exponentially worse when combined with common over-the-counter medications. Studies demonstrate that taking SSRI with NSAID, like ibuprofen, increases your bleeding risk by over 4 times compared to taking neither medication. A comprehensive meta-analysis found that SSRI use alone increases bleeding risk by approximately 1.4 times, but when combined with NSAID, this risk multiplies dramatically. Studies have documented cases of patients experiencing unusual bruising, nosebleeds, and gastrointestinal bleeding requiring hospitalization. Next, number 5. Bone density loss and fracture risk. Your skeleton might be silently crumbling while you take your daily antidepressant. Multiple large-scale studies involving over 55,000 patients have revealed that SSRI use is associated with accelerated bone loss and increased risk of fractures. Research from Korea's nationwide health database found that recent SSRI users had a 35 to 38% higher risk of developing osteoporosis or osteopenia compared to non-users. This bone loss appears to be dose-dependent and time-dependent, meaning the longer you take these medications and the higher the dose, the greater your risk. Serotonin receptors exist throughout your skeletal system, and when SSRI alters serotonin signaling, they may disrupt the delicate balance between bone formation and bone breakdown. Studies show that this can lead to irreversible changes in bone microarchitecture, increasing your fracture risk even years after stopping the medication. Meta-analyses concluded that SSRI use was consistently associated with significantly increased fracture risk. Women over 50 are particularly vulnerable, with some studies showing fracture rates 1.6 times higher among SSRI users than non-users. Next, number 6. Extrapyramidal symptoms and movement disorders. Imagine your body betraying you with involuntary movements you can't control. Extrapyramidal symptoms, abnormal movements caused by disrupted brain chemistry, can develop in patients taking certain antidepressants, particularly those that affect dopamine pathways. These symptoms can manifest as Parkinsonian-like tremors, akathisia, an overwhelming urge to move that feels like insects crawling under your skin, dystonia, painful muscle contractions that can twist your limbs into unnatural positions, or in the most severe cases, tardive dyskinesia, permanent, involuntary movements of the face, tongue, and limbs. Research published in Science Direct documents cases where patients develop these movement disorders within weeks of starting antidepressant therapy. What makes this particularly terrifying is that some of these movement disorders, especially tardive dyskinesia, can be permanent even after stopping the medication. Your brain's motor control systems may never fully recover. Patients describe feeling like prisoners in their own bodies, unable to control sudden jerky movements, muscle spasms, or an irresistible urge to pace constantly. Next, number 7. Heart rhythm abnormalities and QT prolongation. Your heart's electrical system might be under attack without you feeling a thing. Certain antidepressants, particularly citalopram and tricyclics like amitriptyline, can dangerously prolong your heart's QT interval, the time it takes for your heart's electrical system to reset between beats. When this interval becomes too long, it creates the perfect conditions for a life-threatening arrhythmia called torsades de pointe, which can rapidly degenerate into cardiac arrest. Studies show that higher doses of these medications dramatically increase this risk, with some patients developing fatal heart rhythms with no warning symptoms. The FDA has issued specific warnings about this effect, particularly with citalopram doses above 40 milligrams daily. What's truly chilling is that this can happen to anyone, even young, healthy individuals with no prior heart problems. Research has identified specific risk factors including advanced age, female gender, heart disease, electrolyte imbalances, and taking other medications that also affect heart rhythm. The electrocardiogram changes can be subtle initially but progress to life-threatening arrhythmias without warning. Next, number 8. Liver toxicity. Your liver silently processes everything you consume, including your antidepressant medication. But some antidepressants, particularly tricyclics like amitriptyline, can cause your liver enzymes to spike to dangerous levels, indicating cellular damage. While severe liver toxicity is considered rare, case studies document patients developing hepatitis, liver failure, and in extreme cases, requiring liver transplants due to antidepressant-induced liver damage. The insidious nature of liver toxicity means you might not experience symptoms until significant damage has already occurred. What makes this particularly concerning is that liver damage from medications can be unpredictable and idiosyncratic, meaning it can happen to anyone at any time, regardless of dose or duration of treatment. Early signs include fatigue, nausea, loss of appetite, and yellowing of the skin or eyes. However, these symptoms often don't appear until liver damage is already substantial. Regular blood tests to monitor liver function are recommended for patients taking certain antidepressants, especially during the first few months of treatment. Next, number 9. Visual disturbances and visual snow syndrome. Imagine your vision becoming filled with television static that never goes away. Some patients taking SSRI and SNRI develop a rare but disturbing condition called visual snow syndrome, where their entire visual field becomes overlaid with flickering dots, lines, or static-like interference. Research documents patients experiencing palinopsia, seeing trailing images, photophobia, extreme light sensitivity, and nyctalopia, night blindness, while taking these medications. Case studies describe people whose vision becomes so compromised they struggle with daily activities like driving or reading. What's particularly alarming is that for some patients, these visual disturbances persist even after stopping the medication. Your brain's visual processing centers may be permanently altered, leaving you with a lifetime of visual static and distortion that no treatment can fully reverse. The exact mechanism remains unclear, but theories suggest that serotonin's role in visual processing may be disrupted by long-term SSRI use. Patients describe their vision as looking like an old television with poor reception, with constant snow overlaying everything they see. Next, number 10. Dangerous sodium imbalance. Your body's sodium levels are critically important for proper cellular function, and antidepressants can throw this delicate balance into chaos. SSRI can trigger a condition called SIADH, or Syndrome of Inappropriate Antidiuretic Hormone, causing your sodium levels to plummet to life-threatening levels. When your sodium drops too low, your brain cells begin to swell with excess water. This can cause seizures, coma, and death. Studies show that elderly patients are particularly vulnerable, with some developing severe hyponatremia within days of starting treatment. The symptoms start subtly: headache, nausea, confusion. but can rapidly progress to altered consciousness and neurological emergencies. What makes this especially dangerous is that it can happen at any time during treatment, even if you've been stable on the medication for months or years. Healthcare providers often don't routinely monitor sodium levels in patients taking antidepressants, which means this potentially fatal side effect can go undetected until symptoms become severe. Early recognition and treatment are crucial, as severe hyponatremia can cause permanent brain damage or death. Next, number 11. Bipolar mania. Induction. For people with undiagnosed bipolar disorder, antidepressants can trigger something far worse than depression: full-blown mania or hypomania. Research shows that SSRI can flip vulnerable individuals into manic episodes characterized by dangerous impulsivity, grandiose delusions, hypersexuality, and reckless behavior. These medication-induced manic episodes can destroy relationships, careers, and financial stability within days or weeks. Patients report spending life savings on impulsive purchases, engaging in high-risk sexual behavior, or making catastrophically poor decisions while in SSRI-induced mania. Studies estimate that 2 to 5% of patients prescribed antidepressants for what appears to be depression actually have bipolar disorder. For these individuals, antidepressants don't just fail to help, they can trigger psychological states that are far more dangerous than the original depression. The challenge is that bipolar disorder can be difficult to diagnose initially. When antidepressants trigger mania in these vulnerable individuals, the results can be devastating. During manic episodes, patients may experience elevated mood, decreased need for sleep, racing thoughts, and extremely poor judgment. Next, number 12. Discontinuation syndrome. Perhaps one of the most underestimated and misunderstood effects is what happens when you try to stop these medications. Discontinuation syndrome affects up to 20% of patients stopping SSRI, creating a constellation of symptoms so severe they can be mistaken for serious neurological disorders. Patients describe brain zaps, electrical shock sensations shooting through their head and body. Others experience severe dizziness, flu-like symptoms, intense anxiety, insomnia, and cognitive dysfunction that can last for months. Some people report feeling like they're walking on a boat in rough seas, unable to maintain balance. What makes this particularly cruel is that these withdrawal symptoms can persist for months or even years after stopping the medication. Support groups are filled with people describing protracted withdrawal syndromes that have destroyed their ability to work or maintain relationships. Research published in Epidemiology and Psychiatric Sciences reveals that withdrawal symptoms are far more common and severe than originally believed. The UK's Royal College of Psychiatrists has updated their guidelines to acknowledge that antidepressant withdrawal can be severe and last for weeks or months. Next, number 13. Weight changes and metabolic disruption. Your metabolism and weight regulation systems can be permanently altered by antidepressant use. Studies show that SSRI and SNRI are associated with significant weight gain and an increased risk of developing type 2 diabetes. Research documents how these medications can disrupt your body's glucose metabolism, insulin sensitivity, and appetite regulation. Some patients gain 20, 30, or even 50 pounds while taking these medications, despite maintaining the same diet and exercise habits. The metabolic changes can persist long after stopping the medication, suggesting that antidepressants may cause lasting alterations to your body's weight regulation systems. Your metabolism might never return to its pre-medication state, leaving you struggling with weight and metabolic issues for life. The weight gain associated with antidepressants can be particularly distressing for patients who are already struggling with self-esteem issues. Studies show that the average weight gain ranges from 5 to 15 pounds, but some patients experience much more dramatic increases. Next, number 14. Cognitive decline in vulnerable populations. The final and perhaps most heartbreaking effect concerns our most vulnerable patients. Recent research suggests that SSRI use in elderly dementia patients may actually accelerate cognitive decline, hastening the very mental deterioration these medications are sometimes prescribed to help. Studies show that elderly patients with dementia who take SSRI experience faster rates of cognitive decline compared to those who don't. While causality isn't definitively established, the possibility that these medications could be speeding up dementia progression in vulnerable elderly patients is deeply troubling. This raises profound ethical questions about prescribing these medications to elderly patients with cognitive impairment, as the treatment might be worsening the very condition it's meant to address. The research suggests that the anticholinergic effects of some antidepressants may contribute to cognitive decline in vulnerable populations. Healthcare providers must carefully weigh the benefits and risks when considering antidepressant treatment in this population, as the potential for harm may outweigh the benefits in some cases. What we've just explored represents decades of peer-reviewed research published in the world's most prestigious medical journals. These aren't theoretical risks. They're documented realities affecting real people every day. The fact that many patients are never informed about these potential effects before starting treatment represents a significant gap in medical communication. This doesn't mean antidepressants are inherently evil or that they don't help many people. But it does mean that patients deserve complete, honest information about potential risks before making treatment decisions. Your body is the only one you'll ever have, and you deserve to know exactly what you're putting it through. The research is clear, the mechanisms are understood, and the risks are real. Medical agencies worldwide are finally beginning to acknowledge these risks. The European Medicines Agency, Australia's TGA, and Health Canada have all updated their guidelines and warning labels based on mounting evidence. The key is informed consent, the fundamental right of every patient to understand both the potential benefits and risks of any medical treatment. When patients are given complete information, they can make decisions that align with their personal values, circumstances, and risk tolerance. If this video has been helpful in giving you scientifically backed information that you can use to make more informed decisions about your health, please type "helpful" in the comments below. That truly motivates us to continue creating content like this that puts real research into your hands. Please hit that like button, share this video with anyone who might benefit from this information, and subscribe for more evidence-based health content that respects your right to know the truth about your treatment options. Thank you for taking the time to educate yourself about these important health considerations. Stay informed, stay empowered, and never stop asking questions about your health care.